My medical interests encompass both maternal and fetal complications in pregnancy. For moms, that can mean medical complications such as cardiovascular disease, hypertension, diabetes in pregnancy. In pregnancy itself, it can mean hypertensive diseases of pregnancy, such as preeclampsia, preterm labor. For fetuses, for babies, I'm very interested in ultrasound diagnosed conditions or fetal growth restriction, also genetic screening and diagnosis. I am one of only 2 Scripps doctors that is certified in performing chorionic villus sampling procedures. That is a procedure that some women choose to undergo if they have a family history or if they have a fetal condition that they're concerned about. It's a procedure we perform as early as 10 or 11 weeks, and it allows us to get more ideas about certain genetic conditions that could concern us in pregnancy and in the fetus. I want patients to personally know about me that I was a high-risk OB patient, and I understand to some extent what it's like to sit at the other end of the table receiving, unfortunately, bad news. I want them to know that I understand what it's like to live from appointment to appointment, not knowing if that particular ultrasound appointment that day will give me news where I would have to deliver potentially a premature baby. What I love about my job is meeting patients initially in the office, taking them through this amazing journey of pregnancy, and then seeing on the other end them becoming parents. It really is such an incredible journey to go through with them and in their families. What's unique and what I love about the Scripps perinatal program is that you get very individualized, patient-centered, integrated care. Specific to Scripps, you have access to all of the Scripps specialists. So if you have a certain medical condition, for example, a cardiac issue, you have access to all the Scripps cardiology doctors as well. Unique to Scripps compared to the other perinatal services in San Diego, at the end of every single visit that you have for an ultrasound, you have the opportunity to sit one-on-one with a perinatologist to discuss what was abnormal or what was normal about your ultrasound. That's very unique because in some locations, all you get is a scan, your doctor gets the report, and you get the results a day, sometimes a week later. So it's nice for these patients to be able to get real-time discussion about their ultrasounds right away.